2008, tobacco companies spent over $1 million an hour to promote their products. The following program is intended to try to counter some of the effects of this investment and highlight the industry's efforts to attract younger users. Imagine a line of kid-friendly products that are colorfully packaged like candy, but are actually both addictive and potentially poisonous. Doesn't sound possible, does it? Doesn't even sound believable. But this is the new reality of the corporations who brought us the old-fashioned cigarette. With all the new smoke-free laws, cigarettes have gotten a lot harder to sell these days. They're just not half as cool as they used to be, and their sales numbers are under threat. Big Tobacco is taking this threat very seriously. This response involves products that are not cigarettes, but are still designed to deliver nicotine in a wide variety of creative and kid-tempting ways. This product line consists of both smokable and smokeless tobacco products. The smokable cigarillos are designed to look like cigarettes, but because of their cigar ingredients, can get around the ban on flavored cigarettes and also get to bypass the higher tax rate on cigarettes. They're sold in packs of 20, offering a variety of kid-friendly flavors marketed to look very cool to teenagers and are much cheaper than a pack of cigarettes. The traditional cigar has also had a makeover, now coming with fruit flavoring and cool packaging that's clearly not directed at the traditional cigar smoker. Then there's the hollow tube of tobacco leaf, infused with flavors and sweet aromas that the user can fill with tobacco or anything else. They're called blunt wraps, shamelessly echoing the popular term for a joint or marijuana cigarette. They're even more shamelessly packaged to look a bit like fruit roll-ups. Next come the smokeless tobacco products, the chewing tobacco and snuff that have been around for a very long time. Being smokeless, they can be used indoors without violating smoke-free laws and regulations. Chewing tobacco has been associated with cowboys and baseball players for a long time. But instead of becoming a historical curiosity, chewing tobacco is having a new surge of popularity, especially among young people, despite of, or perhaps because of how gross the spitting part of the process is. Snuff is a finely powdered tobacco and has been around in Europe and the Americas and Asia for hundreds of years. To save it from becoming obsolete, the tobacco companies made some innovative efforts to create a new image for snuff. One of these variations is moist snuff, sold under brands like Copenhagen and Skoal. All you have to do is tuck a pinch in your mouth, which later has to be spit out. For those who don't like the idea of having to spit, Skoal offers Bandit mints, which, according to pediatrician Dr. Lee Beers, means that you can sneak them into a classroom. Big Tobacco's latest and greatest spitless product is sold under the name of Snus. Snus does for snuff what tea bags did for tea, except that in the case of Snus, you put a little bag between your upper gum and lip. The flavors are kid-friendly and make it much easier and more comfortable for first-time tobacco users to get started. Another variation of smokeless products are the dissolvables, which were originally marketed as aids to stop smoking. These smokeless products are now on the front line of the industry's big plans for expansion, using an approach that muddies the line between treating versus promoting tobacco addiction. They're also actively test marketing some of the industry's most creative and disturbing products: orbs, strips, and sticks. new products that look just like very popular candies and breath mints. Orbs are Tic Tac lookalikes, made by the same folks who brought us Joe Camel. Like Tic Tacs, you pop them in your mouth and let them dissolve. Unlike Tic Tacs, each tobacco-filled orb contains the same amount of nicotine as one cigarette. A young child ingesting a small handful of these would be at serious risk of nicotine poisoning. The Camel cigarette folks also thought to bank on the popularity of Listerine breath strips by creating a look-alike designed to quickly deliver 1/2 a cigarette's worth of nicotine per strip. They've also adapted the lollipop by removing the candy and turning the stick into pure, tightly packed tobacco, or into a tobacco-coated stick, which delivers 3 cigarettes worth of nicotine per toxic toothpick. Dr. Rob Warren, a practicing dentist, has seen the multiple levels of harm that these smokeless products can inflict.
I think there's over 28 different cancer-causing agents that are found in these products. Same things are found in fertilizers. A number of these products are things that are going to eat away at the gum tissue, just like with the acidic nature of what it does. The saliva makes the mouth very acidic, and that in and of itself is what starts to create more of the problems in the patient's mouth.
As of early 2012, orbs, strips, and sticks have not been available in Wisconsin, but they're being actively test-marketed in other states. We should be prepared for their introduction here, supported by huge advertising investments. And they will, of course, be cheaper than cigarettes and free of cigarette taxes. The bottom line issue is, of course, the health risks these products create for our children. Dr. Teresa Gilbert is an associate professor of pediatrics at the University of Wisconsin-Madison, practicing at UW Health's American Family Children's Hospital.
We know that when adults put them in their mouth, that their heart rates go up, that they feel nauseated and lightheaded for a period of time. So we know that drug is traveling through their gastrointestinal or intestinal tract and getting into their body. What I don't have for you is, you use these regularly, what happens 20 years from now? Are you going to be a setup for stomach cancers?
The tobacco products themselves will do just like what termites do to wood. The chemicals and the toxins in the cigarettes will eat away at the gum. It will eat away at the bone, and it creates periodontal disease and will lead to tooth loss. And that's still the same problem you have no matter what kind of tobacco you're using. The problem is that the tobacco products that are out there now, the smokeless tobacco and the snuff and the dip, they have more surface contact with the gums, which creates more saliva issues in there, and again creates so much more acidity in the mouth. The longer it sits in there, the more problems it creates.
Accidental nicotine poisoning of children becomes another significant risk.
States are reporting increased cases of accidental ingestion by young children of these products. So kids are definitely attracted to these products. I think this marketing is very deliberate with the bright colors, with the flavorings that they have. My children were confused by which is the tobacco product and which is not. And so I think you leave those on a counter, not really thinking of them as you would a pack of cigarettes or maybe a tin of chewing tobacco. A child reaches that, ingests a lot, and has a problem.
As little as 1 milligram of nicotine can produce nausea and vomiting in children. And 1 milligram of nicotine per kilogram of body weight can be fatal. This means that a 35-pound toddler would need only to gobble up about 15 orbs to attain a fatal dose. These products seem virtually designed to promote such accidents. Tobacco companies, of course, deny that these products are being marketed to young people. If that's the case, why are they using candy-like packaging and flavors like strawberry and peach mango? And why do their own internal marketing documents so blatantly contradict these denials?
When you look at the packaging and the coloring and the taste that they're promoting, they're really targeting children. And this is sort of the next wave of Joe Camel, the cartoon. When you're offering flavors like watermelon and pina colada, children are going to be attracted to that. I sort of tested this in my own family with my children. I brought them up to a display of candy and gum and said, pick out the tobacco product here. And they looked at me and went, what? Cigarettes? And I said, well, no, it's not cigarettes. It's nicotine that's in cigarettes that's in a gum-like packaging. And they actually had to pick it up and turn it over, and it was like a little hunt. Oh, I found it, Mom. It says that right here. But they really had to look, and it was very eye-opening, almost shocking to them that that was right. Is that allowed? Is that okay? To them, to know that this was a possibility.
Dr. Warren paints a grim picture of some of the consequences of using these products.
Sadly, I've had a number of cases with patients that I've watched go from the early stages of cancer, being precancerous tissue. We've had it screened. We've actually done swabs, sent it off to get checked out, comes back as being precancerous. Ended up the fact that we had to go in and remove a section of his right lip and part of the inside of the jaw to remove the cancer that had gotten its way down inside of him. Other patients we've had, have had situations where they've lost multiple teeth.
Constant exposure to these products also creates a long list of other major medical problems. One major study concludes that smokeless tobacco users have an 80% higher risk of developing oral cancer and a 60% higher risk of developing pancreatic and esophageal cancer.
Some people call these products poison candy. You could also say drug-laced candy, but I think it is the truth. When young children get a hold of them, they can be poisoned. They can call the poison center and be treated for that. And they're highly appealing. That's the worrisome thing about them is they're being targeted. Children and young adults are attracted to them. They think of them as safe because, after all, they're in the gum and candy aisle. I think there's a tremendous opportunity for there to be abuse and side effects from that, but also for people to become addicted without really thinking about it. And I think that's kind of the goal. Back in the day, it used to be cigarettes were given to young servicemen, right, handed out to them during times of war, handed out in college campuses like candy. We've outlawed that because we know the side effects to them. This is, chapter 4000. We're now into candy that we're handing out like candy. The combination of sugar and nicotine, which we know is very addictive, I think is going to be a powerful stepping point or entry point for children and young adults to pick up the habit.
I think tobacco companies that say they're not marketing to children are lying to themselves and are lying to us.
The crucial question is, should they be allowed to get away with this?
You can make sure that funding for tobacco-related product cessation in the state, that it's been recently cut, that we increase that, realizing that this is a public health problem. You can educate your legislatures on a local level. There are several steps, depending on how passionate you feel about this, that can be taken, that you don't have to just sit here and watch it happen.